Good evening. I'm Lyssa, Chair of the Board of the San Antonio Medical Foundation. We're pleased to be a sponsor of the San Antonio Report's continuation of supporting the San Antonio healthcare and bioscience community. The effort is consistent with the Medical Foundation providing land to institutions growing the South Texas Medical Center and providing seed funding for collaborative efforts in healthcare and bioscience research in San Antonio. If you're interested in learning more about the impressive healthcare and bioscience research being conducted in San Antonio, please visit our website at sabioscience.org. Again, on behalf of the San Antonio Medical Foundation, our thanks go out to the San Antonio Report for educating San Antonians on some of the great things happening in our city.
Hello, and welcome to the 2021 San Antonio Medical Forum. This is our third year producing this forum aimed to spotlight the public health issues and developments in the San Antonio community. And I am Senior Reporter Iris Dimmick for the San Antonio Report. So this year's two-part virtual series begins with today's program on health equity, and the final program will be on September 30th on the San Antonio Partnership for Precision Therapeutics. Thanks to the support of our sponsors, this year's series is free and accessible to all the San Antonio Report's YouTube and Facebook pages. We invite you to share today's conversation and help us ensure these critical conversations are reaching everyone in the community. Before we begin, we want to acknowledge our sponsors that partnered with us to make this year's virtual forum free and accessible to all. A special thank you to our 2021 gold sponsor, the San Antonio Medical Foundation, and our silver and bronze sponsors, including Texas Biomedical Research Institute, UT Health, the University of Texas at San Antonio, and the Texas Research and Technology Foundation. If you have found value in our local reporting on COVID-19 and other health issues in San Antonio and civic engagement events like this, we invite you to donate to the San Antonio Report today and join our valued group of members who support the future of local news. So check out the link in the chat and an event description to donate today. So let's bring in our wonderful panelists. We'll start with Marisa Bono. She's the CEO of Every Texan, and Claude Jacob, Director of San Antonio Metro Health, and Dr. Lyssa Ochoa, President and CEO of the San Antonio Vascular and Endovascular Clinic. Welcome all.
Hi.
Hi. So let me get y'all to introduce yourselves a little bit and tell us about the work that you do, and where you're from, and how that work kind of ties into equity. Marisa, let's start with you.
Sure. Thanks, Iris. It's great to be with all of you today. My name's Marisa. I was born and raised here in San Antonio, and I'm actually a civil rights lawyer by training. I was with MALDEF for almost a decade before joining the city with Mayor Nuremberg, did a brief stint at VIA, and just recently joined Every Texan as its CEO. Every Texan, formerly the Center for Public Policy Priorities, was an organization, was actually founded by the Benedictine Sisters of Boerne back in 1985. They ran a hospital providing healthcare for low-income families in Central Texas. So they kind of saw firsthand a healthcare system that wasn't working for all Texans. So they took matters in their own hand. They founded our organization, and today we conduct research and advocacy in the areas of healthcare, but also food security, education, financial security, and voting rights. So really looking forward to the conversation today, and talking about some of the solutions to the issues that we're facing here locally and statewide.
Mm-hmm. I mean, and like your organization, I mean, health equity is a very broad topic.
It is.
So you cover a lot of different areas. And Dr. Ochoa, I know that saying you're the president and CEO of the Vascular and Endovascular Clinic, you also do much more than that. Tell us a bit about yourself.
Sure. So I am a board certified vascular surgeon, and I'm actually from the Rio Grande Valley, South Texas, where we've heard all about health inequities and how COVID has affected that area as well. As a vascular surgeon in San Antonio, I was able, when I first came, to practice kind of north side and south side of San Antonio. And one of the healthcare outcomes that I follow as a vascular surgeon are diabetic amputations. It didn't take me long to realize that the demographic of patients, the health quality of patients, and the outcomes were very different from north to south side of San Antonio. And when I began to ask myself why and dig into why these inequities were so variable, I learned about social determinants of health and learned that access to care is one part, but there's so much more that goes into health inequities as you're talking about. Mm-hmm. It's been my mission and the Safe Clinic's mission to decrease diabetic amputation rates in the zip codes in San Antonio that have the highest rates. And by doing that, there is no doubt that we have to acknowledge all the social determinants of health. And if we ever move the needle on that number, then I know that everything upstream from that will have changed as well. Mm-hmm. My practice is built on being community-based. I think when the community realizes and trusts you as a healthcare entity, that's when you can get more accomplished. Mm-hmm. And I've recruited 2 new doctors to the mission of the Safe Clinic, and I hope we grow some more.
Great. Well, and so for folks who may not be familiar, can you kind of describe what the social determinants of health mean in this context?
Sure. So social determinants of health are all those other aspects that contribute to healthcare outcomes more than the surgery that I do or the medication that I prescribe. And so in my search as to why we have these inequities, I learned that social determinants of health have a greater than 50% outcome on healthcare outcomes rather than the care that we get. As a surgeon, that was kind of a light bulb moment for figuring out, like, well, me seeing more patients or doing more surgeries helps that patient. But if I plan to affect a community, we have to acknowledge everything else. And that comes from transportation, access to care, healthy foods, making sure access to healthy, safe places to exercise, to walk, education, property values, sidewalks, internet access, and the list goes on and on. Mm-hmm. And that's why I honestly believe that it's going to take the entire community, from the patient to the family to the friends to our city to our county to our state, to really enact changes that will affect all of these healthcare outcomes.
Yeah, it's a complicated web, but all of it goes into how healthy we are. Mm-hmm. And Claude Jacob, welcome to San Antonio. I know you've been here for a couple months, but yeah, kind of introduce ourselves and tell our audience where you're coming from.
Sure. Thank you, Iris, for this wonderful invitation. Can you hear me clearly?
Yes.
All right. Fantastic. Every once in a while, I'm Claude Jacob, the new director here at Metro Health. Been here a couple months. I hail from the Midwest, but just spent the last 14 years running a health department in Cambridge, Massachusetts. Just picking up on the comment that Dr. Ochoa just shared, I truly believe that it takes a village to raise a healthy community. And so we've been in this for the last 18 months. I feel like I'm doing my second tour of duty, having been in Cambridge, helping the team there, and now landing here at Metro Health. We are at Metro Health, a nationally accredited health department. Just about 10% of the 3,000 local health departments from coast to coast have met that designation. It's a voluntary process. So I'm really proud of the team here, and I'm proud of the city's vision to at least raise the bar and the standards for our work as we're assisting San Antonians and residents of Bexar County to get through this colossal experience, this once-in-a-lifetime experience. And so I'm a practitioner on the ground. I've been doing this for over 20 years. So between the state of Illinois, where I was a deputy director at the Office of Health Promotion with the state, I also was at a hospital-based system on the west side running a community affairs program or department. I was at the Baltimore City Health Department many moons ago as a bureau chief. And so now making my way after having done this stint in Cambridge, I'm really excited about being here. And this topic is near and dear to me as I think about the ways that this COVID experience has exacerbated a lot of the conditions that we've been hearing about. And we're just still trying to figure out what else we can offer to help support residents and guests of the city through this experience, but also trying to tell our story about the importance of investing in a governmental public health enterprise. So I'll talk more about our glide path for growth, but just know that this is really an important topic and long overdue, but clearly the COVID experience is amplifying and magnifying lessons learned and forcing us to change the way that we've been doing business and the way that we care for one another.
Yeah, I mean, as you said, the pandemic has kind of brought this idea of health equity into a lot of people's lexicons. Like people who may not have heard of health equity before are now hearing this term. And so I just wonder, Dr. Ochoa, if you could kind of walk us through. I know it's a big ask, but what is health equity? and you know, like how can you demonstrate for our audience members like what this actually means for people?
Very difficult definition, but I think you said it kind of means something different to everyone. And in my mind, when I take the position of my patient, to me, health equity is that patient has equal opportunity, equal access to the information, to the knowledge, to the resources such as healthy foods, exercise, and access to healthcare to keep them healthy. When patients are healthy, they can learn, they can work, and they contribute to our city. One of the examples that I can do, which is kind of the opposite, we had talked about this, is show you what health equity is not. And sometimes it takes a visual to figure that out. And if you would like to put up one of the maps that I've supplied for you, and just give you this is my view of San Antonio and what health equity is not. And so this is a map of every zip code in San Antonio, and the darker blue, the higher rates of amputation. What's interesting is you will find that these high dark blue areas with high rates of amputations are in our urban core, meaning within 410, and the south side, near west side, and near east side. And so that's interesting. This is like the middle of our city. And yet we have some of the largest health inequities in these areas. I can go through a few more of these slides with you, just kind of explain that a little more. So this is kind of the hyperacute view of those dark red areas. And if you look at some of these zip codes, 78237 in the near west side has about 3 times the number of diabetics in the average of Texas. This is one map that I got from Christine Drennan of the Trinity University. And this is a map of red line San Antonio neighborhoods in the 1930s. And we talk about the cycle of poverty and really what social determinants of health. This map is the exact same map of that diabetic amputation map we saw. And this is what kind of spoke to me as to what inequities are. And it starts really from property value and the investment we put in each community. This is a map that we actually created in the SAFE Clinic. And this shows simple NPI numbers. And these are every doctor, every physical therapy office, every hospital, every clinic. You can see up on the north side, we have numbers of 60s and 23 that congregate up to 50s up here. If you go to the south side, we definitely have less access to healthcare from just a person coming down here and giving some kind of healthcare. And so that was also an eye-opening situation for me on what can a doctor do to address these social determinants of health. Those who follow San Antonio and know Lily Casuda know this map, and this is the hardship index, all related to social determinants of health as well. And 410 is in here. This is our near west side, our south side. And the hardship index ranks poverty level, education attainment, household income, per capita, unemployment, crowding, dependency, all these issues that contribute to just what makes it harder to live and harder to get that kind of access to care. Claude mentioned that it's these same areas with health inequity that suffered from COVID and from COVID deaths. And so when we look at the same map, these maps of healthcare outcomes, and they look like the exact same map as red line neighborhoods in the 1930s, we know that there is a connection there, and we have to, with as much intention as those maps ended up the way they were then, work to make change to fight these inequities in San Antonio. So this is just an interesting map, which is one of the things that I have done to hopefully fight that inequity, and is surgical centers. During COVID, surgical centers were very important because they were places where some surgeries could still get done when hospitals were limited on their access. If you look, we have several, over 40 surgical centers on the north side of San Antonio, and we had 0 on the south side. And we just finished building the only, which we built will be Medicare accredited surgery center on the south side, bringing quality, efficient day surgeries to patients who really need it. close to where they live.
Well, those are not pretty maps. I don't like them. but I think it's really important to see, in black and white and red and blue, like where all of those inequities are in the city. And so, but I wonder, Marisa, if you might be able to kind of give us a statewide look of where we're at in Texas.
Sure. I think Dr. Ochoa really hit the point home with those maps, and certainly across the country and across our state, gaps in healthcare and healthcare access are expanding, especially in light of the pandemic. But what's important to recognize that many of those gaps were caused, and the gaps are being accelerated by barriers to opportunity that have been set up at all levels of our society. So you asked, what health equity was, and it's not just access to healthcare, even though that's what I want to focus on, in my role. It's thinking again about those social determinants of health. I mean, it's hard to be healthy if you don't have access to good jobs. It's hard to be healthy if you don't have access to good schools or safe, affordable homes. And so health equity really means increasing opportunities for everyone to live the healthiest life possible, no matter what zip code they live in, how much money they make. And as for our topic today, Texas has come a long way since the 80s when our organization, when Every Texan was founded, but we still have a long way to go when it comes to health equity. Now at Every Texan, we're hyper-focused on expanding access to healthcare, and Texas continues to lead the nation in uninsured people, so that the state's uninsured rate of about 18% is twice the national average. We had over 5 million Texans who don't have health insurance in the middle of a pandemic. And of that group, 70% are living below the poverty line, and 75% are people of color. And most are in households with children. Texas children really are hit with that double whammy when you bring in some of those social determinants like food insecurity. That's a good example. Texas has one of the worst rates of child food insecurity in the nation, with those rates disproportionately impacting children of color. Now, fortunately, these are all problems that have solutions. And I think, everyone on the panel today can agree that we all deserve access to quality, affordable healthcare and life opportunities. And it's really up to our elected officials to make that happen.
Mm-hmm. Well, and Claude, I wonder if you could share, what we have learned about health equity from the pandemic. Has your view of health equity changed at all, or has it just remained consistent throughout?
Thank you. I just want to pick up on the narrative from the last couple commentaries. I got to tell you that what we've seen through the COVID experience is an exacerbation of what's always been there. So this is nothing new under the sun. If you go to the maps that Dr. Ochoa shared, the sad narrative is that these patterns don't change. I mean, you overlay chronic disease, you overlay sexually transmitted infections, you overlay crime, you overlay poverty. The patterns stay the same. And what COVID has done is we ripped the veneer off of but it's really amplified security around employment, around house, food. So I would say that while our task is to make sure we level the playing, we address equities, we need to be more intentional acknowledging the long legacy and the history of these policies that continue to exacerbate then impact the quality of life of residents. So I would just say that at the end of the day, looking at what's happened over time, I can tell you my frame of reference. So the 77 defined neighborhoods in Chicago, thinking about the contrast between East and West Baltimore, looking at the 13 defined neighborhoods in Cambridge, here, new to San Antonio, but the patterns, I got to tell you, it tells a story. So part of our task at our department is to look at these patterns, try to understand a little bit more what's in that ecosystem. It's not shocking to any of you that these patterns have been here for a long time. And what COVID has done is literally put front and stage under the light so that we can see how this is impacting communities disproportionately, especially for Black and brown folks across the county. So to this conversation, I would say what COVID is forcing us to do is pay closer attention, but also figure out how to change the narrative so that we can at least acknowledge that the chronic conditions are exacerbated by COVID. The other social conditions around employment and education are exacerbated because of COVID. So this is why we're having this conversation. I appreciate an opportunity just to talk about some of the innovative work we're doing on the ground.
Right, and some of that work, I know that Marisa or every Texan has been doing work in terms of like seeing how kids and families are affected by, were affected and continue to be affected by the COVID crisis. Marisa, you want to talk about that?
Thanks, Iris. So you're right. Every Texan had a new report last year, the Texas Kids Count. Health Equity for Every Texas Child was the name of the report. And the data book, the Kids Count data book, is a 50-state report developed by the Annie E. Casey Foundation that uses census and survey data to analyze how families with children fared through the COVID-19 crisis. So we have that report for Texas, but we also have it for the other 49 states, so we can kind of see how we measure up. And I'll put it this way, Gandhi said that the true measure of any society can be found in how it treats its most vulnerable members. And if that's true, what we've learned during the pandemic is that Texas is definitely not measuring up when it comes to our kids. The report itself uses 16 indicators across 4 areas. So health is one of them, but also education, economic well-being, and community. And this year's report really brought into focus the millions of children in this state who don't have food security or healthcare access or economic security that they need to thrive due to disparities rooted in systemic racism. And so I provided the link to that report, but when it comes to healthcare and health indicators, the biggest gap between Texas and other states and between Texas families of different races and ethnicities is in health insurance coverage. So twice as many Texas households with children reported lacking insurance as the rest of the nation. That was 23% versus 11%. And Hispanic households with children were the most likely to report lacking health insurance. And that rate was 40%. Which, think about that, is a majority minority state when 40% of Latino households with children don't have access to affordable health care. That really speaks not just to their state, but to the future well-being of our state.
Well, and I know that this is a broad question as well, but Claude, you mentioned all of these patterns. How do we change those patterns? Like, what are some examples of policies or programs that are on the ground today trying to shift that narrative? And that's open to
Thanks,
anyone.
Iris. Yeah, no, just to tee it up, and I'll turn it over to my colleagues. So when it comes to the COVID experience, we've been having very unique experience the last 18 months, yet we're not trying to pivot to see what else we can offer to support residents through this. So innovative programming where we tap into the assets on the ground. So any outreach activities where we work with our community health workers, where we have the models that anchor the promotores. We've used these neighborhood ambassadors, at least what we did back in Cambridge, but I can tell you, I see the same models here on the ground. It demonstrates the power of the trusted source, and it anchors the community, whether it's the nonprofits, faith-based organizations, or the local bodegas, just to make sure that people know where to go to get the trusted information. That being said, I do like the examples, the heat maps. You remind me, Dr. Ochoa, why we use these maps to figure out where to deploy our assets and our resources. So the maps are telling. Sadly, the patterns don't change, but we use that to figure out where to send folks, where to focus our energies. For example, our pop-up clinics, our COVID testing tents, the ways that we pay attention to the uptake of vaccine or those that are still hesitant. So we use the science, we use these maps to figure out with limited resources, where do we deploy? And so I like the example of showing these maps. And I would just add that with our mobile teams, we look at a COVID-19 equity index. This is something that we've developed. It allows us to look at census tracts It allows us to look at the high concentration of low-income residents, allows us to look at the zip codes, the higher levels of COVID-19. Plus, we look at the burden, not just morbidity, but mortality specific to these areas, as well as making sure that we over-communicate the importance of getting vaccinated, because that's the best way to protect yourself from COVID-19. So I would say at the end of the day, we do have some innovative programming coming online. We do have activities already in play that dovetail with our violence prevention program, our mental health initiatives, working with our community health workers, working with our healthy eating and active living portfolio. So it's tapping into those assets, working with partners on the ground, but making sure that we're getting the consistent information in the right places so folks can make the best decisions to protect themselves.
And Dr. Ochoa, I wonder what you see on the ground. What are doctors doing to affect these patterns?
Well, I think Marisa made a great point in part of the challenge when we consider access. Access means different things. I mean, just to health insurance. I mean, the fact that was an astounding percentage, 40% of Hispanic families don't have health insurance. That's my entire community here in the South and the West Side. And I asked myself, I know what I'm doing, some doctors are doing. What I specifically have been trying to do is at least acknowledge the transportation for access to vascular care. And so that's why I actually have clinics in all those zip codes in the maps that I showed you. I have 6 clinics across the South Side, West Side, and soon we're coming to the Near East Side to make just access to us easier. It's easier when we go to the patient than expecting them to come to us. There's several other doctors in the South Side that realize that this is an issue and have dedicated their work to serving on the South Side in these underserved areas. One of them is Dr. Ray Altamirano. He is a family practitioner and he provides at-cost medical care, contracts with labs and with radiology to get at-cost care to give patients what they need on a pretty affordable cash basis. Dr. Maria Palafox is a general surgeon who has created a nonprofit to create a breast cancer screening and treatment on the South Side, and she's asked me for some of my help. And so it's great when we have like-minded physicians working to that similar goal, but there's always that bigger picture. And so I would like to ask my colleagues, what can a physician like myself, who recognizes the problems, who I can do what I can do in my community, but what role do I have at the city level, the county level, the state level to try to move the needle? What can we do as practitioners who see it on a daily basis?
Well, I can tell you, Dr. Ochoa, I think healthcare providers in our community, both locally and statewide and nationally, just have the highest level of credibility when it comes to influencing our policymakers. It's the education and also the on-the-ground experience. That combination, I just think, makes people in the healthcare professional eminently credible when they're talking about what needs to happen on the ground to address these issues. At every Texan, we coordinate a lot of testimony to try to paint the picture of what's going on the ground for lawmakers that are in the Capitol, and also to meet with lawmakers one-on-one, trying to negotiate bills to address some of these gaps. So would really love to bring you into our group and see ways to plug in there. And really anyone watching, it's everytexan.org, and there's a button for ways to get involved. There are also organizations. There's a fabulous nonprofit called Texas Doctors for Social Responsibility, who want to step outside of their day-to-day practice to engage in these policy conversations because they're sick and tired of seeing their patients get the short end of the stick. So would really recommend checking out that group. They have their annual conference coming up next month.
Just want to add, Dr. Ochoa, thanks for being an ambassador further upstream to talk about the different factors that impact and influence health. I think earlier in your comment, you talked about the fact that it's the smaller percentage of factors that actually are attributed to healthcare. So we do have to do a better job translating the importance of these policies for housing, education, and food and whatnot to make sure that folks can take better care of themselves. So I look forward to having you as an ambassador and a distant cousin to the work of Metro Health, but also thinking about your networks and the way that you can translate that it's not just about the work in the emergency department or in these clinics, but also out in the area neighborhoods. And however we can at least be consistent in our messaging, I think that that will also help us move the needle. So I applaud your lens. I applaud your use of the heat maps to deploy your clinic sites and resources. But I also want to engage you to figure out how else could we translate this a little bit better, recognizing the power of the trusted source, especially in this COVID experience, that folks do trust their clinical providers. And we've got to figure out a better way to have you help us as we continue to not only deal with COVID, but any other constellation of conditions that impact the quality of life of residents. So thank you.
Yeah, and those constellation of social determinants of health are key. But I did want to give Marisa a chance to talk about when we spoke before this panel. It is a relatively simple fix. Is the expansion of Medicaid and what that would look like and the challenges. So I just wonder if you could kind of give us an idea of how close or far away we are from actually doing that in Texas.
Well, let me just start by saying, look, expanding Medicaid to cover the uninsured in Texas, among which Black and brown people are overrepresented in Texas. That one act is probably the best, easiest option to address health disparities, including COVID-19, period. And so to explain what that means and what that looks like, Medicaid is the federal state health insurance program that covers Americans with limited income. The Affordable Care Act, the ACA, called for expansion of Medicaid eligibility in order to cover more low-income Americans. So under the expansion, Medicaid eligibility would essentially be extended by age and by percentage of the federal poverty level. But back in June of 2012, the U.S. Supreme Court ruled that states could not be forced to expand eligibility for their Medicaid programs. So it was left to each state to determine whether to participate or not. And Texas so far has refused. In Texas, the total household income for a single parent with 2 kids cannot exceed something like $230 a month. So it's very difficult to qualify for Medicaid in Texas. And if Texas were to expand access, that would mean healthcare coverage and access for over 1.4 million Texans. And so there was actually, in our most recent regular legislative session, there was actually a bipartisan push with some bipartisan bills in the state house to expand access to healthcare through Medicaid expansion. Because I think both sides of the aisle realized how important that was in the middle of the pandemic. But unfortunately, our state leaders blocked hearings on those bills in committee, and they didn't move. And since then, as the governor has called additional special sessions, this has not been listed or considered an emergency item to be placed on the special session agendas. And so really the fight has moved to the federal level, where there has been progress at the congressional level to try to create expansion in other ways, in ways that are lawful, that kind of pass the U.S. Supreme Court's tests, but don't necessarily require state action for expansion. So we've definitely seen some movement. I think we're really at a crisis point. The tension that we've seen in Texas with the impact that the uninsured rate has on our economy and our schools and our families, that's playing out across the country. So hopefully we'll see some action at the federal level where we have not seen at our state level.
Dr. Ochoa, did you have something to add?
Oh, sure. I look eager, don't I? So, Marisa, thank you for saying that. And as like, if there's one thing that we can do, Medicaid expansion in Texas provides health insurance. But I'm going to tell you on this local level, the South Side, West Side level, is just real access to physicians. On the South Side, we are a deficit of 180 primary care physicians. And so even if we had Medicaid expansion, which needs to happen, we also have to be thinking on, well, what's our next step and how do we get the care that they need? You know, one thing that San Antonio has is we have a lot of great community partners. University of Incarnate Word has built a medical school on the south side, and they see these inequities, and they're actually trying to train their medical students through the lens of social determinants of health. And they actually have started several residencies in the hospitals on the south side, with the idea that if you train and you understand the disease pathology, that maybe we can recruit more patients, more physicians to stay. And so that's one thing that I think we as on the local level is, how do we recruit these physicians who are trained here to stay here? There's no doubt that there's a challenge in the business of medicine, and it's just what it is. But I do believe that what we can be part of that education is showing physicians not just the medicine, but how to practice evidence-based medicine in a community, realize that outcomes are community-based and not just the individual surgery that I do, or that broader education will hopefully entice more of our physicians to stay locally and help those communities that really need it.
Well, and Claude, I'm wondering if there's anything, is there anything that Metro Health or the city can do to increase that kind of health investment that's clearly needed in the south and near west and east sides?
Yeah, thank you. Just picking up on the comments. So we have now a blueprint for a 5-year plan, a strategic growth plan. And there are 4 priorities reflected in that. It's our work around mental health. It's our work around health justice. It's our portfolio around improving access to care. And it's really shoring up the infrastructure anchored to the work of our department. So all that to say that to drill down in terms of the access to care portfolio. So there are some key initiatives embedded in that. Given all that we've heard already from my colleagues, for example, tapping into the assets in community. So our community health workers to establish an actual hub as part of the design. So we make it a little easier to have a buffer for all the challenges systemically for folks to navigate and to have as high of a quality of life as they can muster. We're designing a medical legal partnership initiative on the ground. We are designing a clinicians ambassador initiative, again, tapping into Dr. Ochoa's lens and trying to amplify the cadre of folks that can help us as trained clinicians, as trusted sources in community. So again, the pillars of our growth plan are very clear. We are in the process of designing and shaping, and this is a way to amplify at least some of our programming that address access to care, nutrition, violence, and the impacts of violence in community. And so just know that these are things that we have as part of our 5-year plan that we'll be rolling out over the coming months.
Great. And, Marisa, I wonder if you would ask your question publicly that you shared in the chat, because I think it's a very good one.
Well, sure. I just didn't want to put anybody on the spot, but I think that's really incredible what you just laid out. It gives me, I love that the city is thinking in a targeted way to really kind of start addressing those systemic disparities, and was just curious about the level of coordination between the city and the county, and wanted to know whether that strategy was coordinated with the county to potentially help combine some of those resources.
Spot on. Again, we didn't rehearse this, but just to acknowledge that we are Metro Health. We are anchored here in the city of San Antonio, but we are clearly a resource for the broader district, for the Bexar County. So yes, as we speak, we're in the throes of not only laying out our blueprint. You're getting the trailer here, but just know as point of fact, that is the plan, because our jurisdiction covers the 2 million plus within Bexar County. So just know that the pillars are very clear around our work around mental health, our work around health justice, our work around violence, our work around access to care, and really shoring up the infrastructure, given the experience that we've seen tied to the last 18 months. So by design, yes. And add to that, one of the really complicated spaces has to do with the behavioral health side of the ledger. So we are having active conversations. I am a member of a broader task force anchored to the county. So being new here to San Antonio, but not new to public health. So I just want to say that I applaud the city's leadership for thinking about this. In my head, it is the COVID pivot. At some point, we have to go back to addressing these broader conditions. And so I'm pleased to see that we're positioned. but I'm also looking forward to engaging other partners like you, Marisa. So I've got you on speed dial now.
I would love that. So every Texan has been engaged with local municipalities and counties, trying to help them think about equitable COVID recovery, not just a pivot, but an equitable pivot. And we really like sharing best practices with other local cities and counties. So would love to get more information so that we can try to get others to replicate and think about the same.
Fantastic. We do have a citywide coalition. Again, this was birthed through the COVID experience. So the COVID-19 Community Response and Equity Coalition. I'm familiar with the architecture of the coalition. I do co-chair the steering committee with a colleague from UT Health, Dr. Barbara Taylor. So just want to applaud the team and our partners for helping us to stay the course. But it sounds like, Marisa, you would be interested and engaged. Just know that I'll be circling back to you to figure out the coordination of our services. So really.
Oh, go ahead, Lyssa.
Yeah, great question, Marisa. So my question to you, because my lens is kind of very focused in my neighborhoods here in San Antonio, but do you have a broader view perhaps of other counties or cities who have done a better job of health equity and distributing resources? I mean, I guess my question is, can we learn from someone who's done it better? And Claude, maybe that's a better question for you as well, having come from a completely different state.
Absolutely. So, I know from our previous conversations, Dr. Ochoa, that there was some interest in trying to see, okay, can we measure kind of what we were kind of calling uninsured gaps or underfunded gaps from county to county. So is there a way to sort of compare how each county is doing so that we can identify the good counties for best practices and learn from the folks who are, doing it right? And took a look to see what I could find in terms of data. And unfortunately, and surprisingly, that data isn't collected or reported in any uniform way. We don't have more nuanced level data because no one really collects that information uniformly across counties. And so we barely have data on people who are uninsured, much less people who are underinsured. The only things we really do have access to are county concentration of uninsured, and then perhaps county by county, the percentage of people that would gain insurance through Medicaid expansion. But that being said, it's true. The larger urban counties in Texas do generally have programs for the uninsured, including Bexar County. Our program's called CareLink. Bexar is considered to have one of the better programs historically. For example, it doesn't exclude mixed immigration status families from coverage. Texas is one of only 6 states that don't allow legal permanent resident immigrants into Medicaid. And Bexar's program, unlike some others, doesn't base eligibility requirements on immigration status. But I think even if we don't have the data for comparison, there's certainly some best practices out there that we could look at and think about replicating. Dallas County, for example, reformed their program for the uninsured so that the program itself isn't creating medical debt, which is one of those social determinants that can increase negative healthcare outcomes. The pandemic derailed a lot of work towards improvement and coordinating for reform. And I'm excited that now that we're hopefully starting to move out of the worst part of the pandemic, that work can get underway again.
Claude, I wanted to make sure you had a chance to answer as well.
Just a fantastic question. Lessons learned from other parts of the country. 2 things. One, and speaking as a past president of NACHO, the National Association of County and Health Officials, representing the 3,000 local health departments, a structural challenge that red and purple states, you have different ecosystems. So even as we define best practices, recognizing that there's an environment within which these practices work well. So we just have to keep that in mind as we think about what work here. Sometimes these initiatives end up being square peg, round hole, and we just have to be cognizant of that. The other is that even just being new to San Antonio and Bexar County, I realized, this is a large metropolitan service area, there's a variety of different pockets, right? You've got the urban node, but you've got the suburban parts, you've the unincorporated parts of the county, and that requires different tools to connect with folks. So it's not just social media platforms, it's the boots on the ground outreach, it's working through the trusted sources. So all that to say that we are in listening mode. We spend a lot of time comparing the work of Metro Health with the larger health departments across the country. So we are an active member of the Big Cities Health Coalition. We do pay close attention to lessons learned in other parts of the country, but we're also realizing in hearing and sharing and comparing notes that we use different approaches. So whether it's the way that we put together flyers or the way that we engage our neighborhood ambassadors or our interface with public safety or with the schools or with the private sector. So all that to say that we have an opportunity to share our story. And lastly, I would just remind folks that this city and the city of San Antonio was recognized by the Robert Wood Johnson Foundation as a Culture of Health prize-winning community. That's a newer initiative that's rolled out over the last decade. More recently, we were recognized by the de Beaumont Foundation for our policy level work. And so that's what tends to move the needle. So I'm proud and pleased to see that here. I hail from Cambridge, where we had similar recognitions nationally. So we'll continue to compare notes. We'll continue to share our stories, and we're learning each and every day about how we can become better at supporting the quality of life of residents here in Bexar County.
Thank you, Claude. And with that, I think it's about time that we open it up to our audience Q&A. I know that there's been a few comments set in via social media. This is from Dr. Deanne. What do you think the role of the Bexar County Medical Society is, should be, or should have been during the pandemic? It has 5,000 members of diverse specialties that reach tens of thousands of patients. Were they effectively involved in Metro Health decisions making and expansion of mitigation and vaccination efforts? Claude, that seems to be directed towards you, but I'm not sure that you are aware of what the society did.
No, I'll just tee it up and I'll defer to Dr. Ochoa. So they are a partner of ours. Clearly, if I'm thinking about the rollout of vaccines, getting shots in arm, we depended on this array of providers out in the open space. Right now, clearly the situation continues to change in terms of booster shots and access to doses. And is it J&J? Is it Moderna? Is it Pfizer? Calgon, take me away. And so we do depend on the medical society as an amplifier and as an extension of our work. But let me defer to Dr. Ochoa to answer more concretely a role that the society may have taken here locally.
Sure. Yeah, we take great pride that Bexar County Medical Society has such a large membership. I think it's the largest in Texas, actually, even bigger than Houston. And I know that during this COVID pandemic, broke out in committees and really try to create plans and strategies. How much they were allowed to collaborate with Metro Health or with university health system. I think that's something that we can do better. I think one thing that the COVID pandemic has opened our eyes is not only the health inequities, but the fact that we have resources, but collaboration and strategic planning on, for example, targeting those heat maps where we know, we could have predicted where COVID was going to hit hardest, and we could have predicted where vaccines are going to be harder to access. We could have, I think, if we brought these experts of medical professionals who are here for a reason to contribute to that conversation and really have strategic planning, I think that next time we will be able to better strategically plan how we target those heat maps and anticipate what we know is going to be an issue. I know it's going to be something that will be harder. It's going to be harder to create access where there's not, especially during a pandemic. But now that we know better, now that we know the challenges, we should be able, through collaboration, to fulfill that need that the city is going to have, whether this happens again or there's going to be something other epidemic that will be a challenge for us.
Well, and so is an effort to improve that coordination underway, and who's in charge of that? Is it Metro Health? Is it STRAC? Who takes ownership over, okay, next time we're going to do this better?
Yeah, let me just say, again, as a newcomer, I appreciate we do have these nodes as part of our collaboration. Our public health framework requires that we mobilize partnerships at work, that we enhance and improve the linkages to healthcare and health services. So what I will remind folks is that we're still building the plane while flying it. We have not seen at this acceleration in our lifetime. So I do appreciate even recognizing the partnership with Bexar County Medical Society, but to our partners at STRAC and to the hospital systems here in the city and in the county, I just want to say thanks. So I'm open to hearing about the 2.0 version of the collaborations, but just acknowledging that we already have touch points with our national and our county levels networks.
Oh, next question, I think, or unless, yeah, okay. From John M. What policy efforts are needed to deal with obesity, which is at the core of many health problems such as diabetes, fatty liver disease, cardiovascular disease? In addition, as we tragically noted, obesity, with or without diabetes, was and is one of the very important risk factors for COVID morbidity. Excellent question. Claude, you want to take that one on, and then we can go to Dr. Ochoa and Marisa.
Sure, up further upstream, and then talking about the implications further downstream. So COVID data, we're looking at data in terms of admissions, COVID patients, and if I understand correctly, half the patients that tied to COVID are diabetic. And so it just reminds us of this constellation, these conditions, that we need to do a much better job in addressing the health needs. So I would tell you, we're looking at housing policy. We're looking at education policy, how we can do a better job with the alignment of this. We're looking at employment policy. So applying a health in all policies framework while we're talking about healthy eating, active living, and in particular obesity, the burden of obesity, we have to look at least the alignment of these policies to make it easier for folks to eat, access healthy foods, but also to recreate so that they can burn these calories. So all that to say that it's not linear. However, we address the conundrum of obesity, but just know that we do have an Office of Health Equity anchored to our department. We are pulling together an office of policy and engagement. This is something that the team has felt is a different way for us to connect with the partners on the ground. And plus, I mentioned the Community Response and Equity Coalition. So a lot of this, we're looking at the collaboratives like a food security collaborative across the city to figure out if there's a different way that we can address these policies. So more to come. I will tell you that back in Cambridge, we did stand up a Food and Fitness Policy Council. I watched that evolve over time so that we could do a better job, at least in that ecosystem. So I'm seeing that type of collaborative coming online to address the burden further downstream, these diabetic amputees and how that's impacting the quality of life of residents. So just stop there just to say the way, but also interested to hear more about what else we could offer.
Yeah, and Dr. Ochoa, you deal with those downstream impacts every day.
Yeah, obesity is a medical condition that like the question has said, predisposes to diabetes, to high blood pressure, to cardiovascular disease, heart attacks, strokes, and definitely worse outcomes with COVID. But obesity, like diabetic amputations, which are further downstream, are all a result of these social determinants of health. And so the health of a person is best predicted by the zip code they live in more so than the care that they get. And that's when I'm reminded that the community environment is what we have to be better. And whether that's our schools and education of how to eat and exercise is important. Sidewalks and our bike trails so the kids can get out and exercise. Creating the environment of healthy eating and activity is going to be at the community level. There's a lot, I'm sure, with policy from the city and the county level that can help with that. Access to healthcare as well. Right now, we on the south side of San Antonio, we have 2 hospitals that provide care for over 400,000 population. One is a 100-bed hospital, the other one's a 250-bed hospital. Pretty small hospitals for that population. I mean, in a dream of dreams, maybe we create a new hospital system, county hospital system on the south side to really serve that mental health and these chronic medical conditions and be in the area that's closer to them. That would kind of be a dream, as well as how we can maybe create some policy to really enact big change for these inequities.
Go ahead, Marisa.
Oh no, I love what everyone's saying. Like really kind of be pulling the conversation back out and focusing on those social determinants of health. And just wanted to make sure, our city just made a big investment in public transit and mass transit ridership. There have been many studies that have shown that it's related to lower obesity rates across the United States. So it's all interrelated, and there was a reference to sidewalks and bike trails, but certainly our investments in public transportation, thinking about how to strategically use those investments to increase health opportunities for better health outcomes here in San Antonio.
Great.
Iris, just acknowledging the comment about place matters and zip code. Sadly, in this broader narrative around health equity and inequities, where you live should not determine how long you live, but that's literally what we're seeing out here based on the sad legacy of redlining and the constellation of other policies that are impacting today the quality of life of residents. So acknowledging the innovation on the ground, like transportation and bike trails and the healthy markets, but also recognizing that the zip codes, which is why we use the science to figure out where to re-engineer an ecosystem to make it easier for folks to have equal access and a fair and opportunity for equal health.
Yeah, I mean, seeing the map as well, you maybe could add that to your slides, Dr. Ochoa, about the map of life expectancy by zip code is equally as disappointing. And I think we have one more question from my boss, Robert Rivard. What will Claude Jacob do with the expanded Metro Health budget for fiscal year 2022?
Thank you for that question. Again, I mentioned about our strategic growth plan. That's the largest investment within our portfolio. Within that, it's our violence prevention programming and the expansion and the enhancement of that. So it's our work out in community. Some of you know about the Stand Up SA program. You know about our domestic violence initiatives, our crisis response teams. Just know that we are piloting a couple of initiatives anchored to SAPD, but just know that this is a 5-year growth plan that we've designed, and the pillars are around our work around mental health and domestic violence, our work around health justice, our work around improving access to care, and yes, an opportunity to shore up the infrastructure anchored to Metro Health, recognizing that health departments across the country are under-resourced. And so this is an opportunity to have a 5-year growth plan and a glide path to shore up so that we're better prepared for the next time a storm like this hits.
Great, thank you, Claude. That kind of wraps it up in terms of Q&A, but I wanted to give y'all an opportunity to kind of have some closing statements, but also maybe as a service to our audience members, please include something that people outside the health industry can do to increase health equity in our community. I think that would be great to hear from y'all, from the experts. Dr. Ochoa, why don't we start with you?
Sure. Well, thank you for inviting me to this conversation. What gets me excited is when I see so many partners in our community working for the same goal. And where there's a will, there's a way. I know that we all have put a concerted effort into acknowledging these health inequities, as complicated as it is, that we will be able to move the needle. When I ask, what can every individual do? That's kind of hard, but I'm going to bring it down to my specific level as to my patients. And one of the challenges that we have also is just knowledge and access to the information that's needed on identifying who needs help, where to get it. And so I was actually on another panel yesterday for Vascular Cures, which is a nonprofit, and we had actually patients and their families speak. And one thing that they said is what they appreciated was that knowledge, and that they now could share that knowledge and that information. And so everyone watching has probably learned something or knows something, and I encourage you to use that information, knowledge you have, share it with your friends and family, to realize that that can make a difference in someone else's life. And when everyone in the community is doing that same thing, and we have, like I said, this concerted effort, that's when I think we're going to really enact change.
Great, thank you. Marisa?
Thank you. I hope it's clear after this conversation that recovery is an opportunity to rethink a lot of things, to rethink the way that we did business previously, to rethink the way that we did policy previously, and to think about how to make investments that create real long-lasting change and get at the cycles of intergenerational poverty that have afflicted San Antonio for so many decades and that have afflicted the state for so many decades. I would just encourage, and information is really important, educating yourself is important, but this is really a time where it does make sense to get involved. It does make sense to engage. And my call to action is to go to the Every Texan website. We have a page that actually lists ways that you can get involved. It's everytexan.org. We want your advocacy and your perspective at the Capitol, and we want it in our coalition efforts as we try to move to creating better opportunities for healthcare and removing barriers to healthcare and access in our state. And I again just appreciated the opportunity to join all of you today and really enjoyed the conversation.
Thanks. We're so happy to have you here. And Claude, maybe you can close us out.
Yeah, no, thank you. Fantastic discussion. Really appreciate the opportunity. A couple quick things. This is a reminder why we have to be even more intentional with recognizing the impact of structural and institutional racism on the quality of life of residents. So that's one piece. The opportunity tied to the COVID experience is to tap into assets on the ground, ensure that there's a better alignment of our efforts. And we heard about the importance of coordinating, say, the city and the county, but really at the end of the day, it's deputizing folks across the village to really be better ambassadors of our work. So to me, the takeaways are really a reminder about the importance of investing in public health to address these inequities. It's about building better capacity to address crises. Again, I've already talked about the growth plan and our emphasis on mental health, for example. But at the end of the day, there's an opportunity to rebuild trust in public health. And again, that's my biased opinion, but I do feel strongly that it takes a village to raise a healthy community. So through this discussion, I'm really inspired by your commentary. Dr. Ochoa, I appreciate all those heat maps. And Marisa, I've got you on speed dial, thinking about how you can help us at least with our work, not just in the city, but also in the broader county. So I'm inspired today. And thanks again for allowing me to invade this space as a newcomer to San Antonio.
We really appreciate you bringing your newcomer perspective to this conversation, Claude, and thank each and every one of you for coming and sharing your thoughts. And I'm super glad to see that y'all that this conversation will continue after we log out of our program today. So I really appreciate it. Thank you. Oh, okay. So thank you again for attending our 2021 Med Forum today. Thanks to our gold sponsor, the San Antonio Medical Forum, and to our silver and bronze sponsors, Texas Biomedical Research Institute, UT Health, UTSA, the Texas Research and Technology Foundation, and University Health for making this year's event free for all to attend. And join us for the next event in our series. It'll be the San Antonio Partnership for Precision Therapeutics, a $1 billion research collaborative. That'll take place on Thursday, September 30th at 12 p.m. Central Time. And you can register on our website. That's www.sareport.org/events. Thank you.